During this course, you will learn about the components of bloods, the different types of cells, looking and making blood smears, and also performing CBC differentials or CBC complete blood counts. You'll be talking about running chemistries on your machines, what the different chemistry assays do, understanding the parameters of those, different techniques used in cytology and obtaining samples, and the technique or procedure of running a urinalysis. Quality control is basically a series of actions or procedures that ensure that the lab processes and operations run efficiently and also guarantees the production of accurate and reproducible results. Some of the principles in quality control are precision and accuracy. Accuracy is the difference between the observed average value and a standard target value. Precision is the consistent results of repeated measurements regardless of closeness to a standard target value. Precision is basically free of accuracy. So if you look down here on the chart here, we can see that there is one side represents accuracy, low and high, and the other side represents precision. So when accuracy and precision are both low, we have results that are far away from the target, and they're also far away from each other. When accuracy is low but precision is high, the results are all far away from the target, but they are also very close to each other. And then over here we have low precision and high accuracy, which means that the results are far away from each other, but they're closer to being the correct value. And then what we aim for is high precision and high accuracy, which is when the results are close to each other and they are also close to the correct or true value. And reliability is basically the combination or having both precision and accuracy. And one of the things that we can do to ensure that our machines are giving out accurate and precise results is to always be on top of quality control. And then we can also send out our results to another lab to make sure that we're getting the same results as everybody else. And also make sure that we are considering the procedure of obtaining and running the sample correctly. Make sure that we have a clean stick and that we're using the right tubes and that the blood is separated properly, and keep all these things in mind when we are looking at the results. So as a technician, whether you are running in-house machines in your clinic or if you work for a veterinary diagnostic lab, you would do quality control on your machines. Usually the machine reps will come by and answer any questions and show you how to do it. And then usually these machines have a manual as well that explains the quality control. So there are usually some control samples that may be kept in the freezer that are run through the machine. They are run like a regular sample and they're designed to come back with normal or within reference range values. And if they do not, then the quality control does not pass. So it needs to pass for you to run samples on it. So some of the things that we do to troubleshoot when the quality control doesn't pass is we may have to calibrate the machine. The machine may need to be cleaned, like the tubing or the filters, or maybe the waste needs to be emptied, the waste container on the CBC machines. We have to make sure our controls are not expired, or calibrators, make sure we're using the right lot number. And all this stuff we keep track of usually in a log book where we, depending on what the SOP is, whether they want it run once a week or once a month, we write down when we did it, we initial it, and we date it to keep track of whether or not the controls were run and whether or not they passed or failed. And if they failed, obviously we should not be using that machine to run samples for patients. So you always want to make sure that your machines are up to date. Again, you always want to do the maintenance cleanings on them. You always want to check that your control samples are not expired, check the lot numbers, calibrate if needed. And these machines always should have a power surge because they do use a lot of power. Another thing to consider is the actual sample quality that you are putting into the machine for the test. If the sample is not large enough for the requested amount from the machine to run the test, it may suck it all up and then suck up air, which will mess up the test and probably prevent it from running the blood at all. It may error out. And then any artifact that may be in the blood. Certain artifacts that we're going to discuss specifically are hemolysis, which is the first one, or cell lysis on the left here. And that can happen due to different diseases, but it can also happen due to errors in either obtaining the blood or not letting it finish clotting before you spin it down, or not spinning it down enough so that the blood's not separated enough. And this can affect certain results, like magnesium and potassium can be falsely elevated. Liver enzymes can be messed up. And then to the right of that, you see a lipemic sample where the sample is very cloudy and thick looking. And this usually occurs if the patient just ate or if they have really high triglycerides. And these samples can actually mess with the chemistry machines. Some of the chemistry machines read the value of the sample by shining light through it and measuring the reaction with the light. And it can't do that if the sample is so opaque. So some of the liver enzymes specifically get screwed up when the blood is too lipemic. And then to the right of that, you see the nice clear straw serum sample, and then to the very right is an icteric sample. You see that yellowing from bilirubin. This is usually due to liver disease, which is similar to what happens to tissue that we call jaundice. So all of this stuff, the skill involved in obtaining the sample and any artifact that may be in the actual blood sample can also affect results. So in the laboratory or in the animal hospital, we do need to be aware of the safety issues and also our PPE or protective equipment. All hospitals should have sharp containers for your needles and catheters and slides. And depending on the hospital, some do put certain things in there and some don't, or they like to separate them into separate sharp containers. And then eye wash stations are required by OSHA. We do deal with a lot of chemicals, and gloves are very, very important. Make sure you guys are always wearing your gloves so you can protect yourself from certain zoonotic things like leptospirosis or mange, for example. And then also be aware of your safety data sheets. On the right is an example of a safety data sheet. The 4 squares that are on it are going to represent different aspects of the chemical that you're looking at, and the red is representative of whether that chemical is a fire hazard, and there will be like a number in here, and you would compare it to the chart on the right. This is just an example one, it's empty. And then the yellow is whether or not this chemical is reactive, and then the blue is whether or not this chemical is a health hazard, and then the white is basically anything that doesn't fall into those 3 categories, something specific. OSHA requires that all safety data sheets be updated and all staff must know the locations of these sheets at all times. So basically, you should know where they are. You should be able to access them. And also, if we are using any secondary container, so if you're moving that chemical from its original container to another container, like a spray bottle, for example, you do need what's called a secondary container label. And this is an example of one on the right here, where you would fill it out based on the information that's on the original container before you put that secondary container out somewhere for people to use. A refractometer measures the concentration of different solutions by measuring the angle of refraction, or the degree to which light changes direction when it enters the liquid. They are used in all different industries, and in vet med, we use it specifically for 2 functions really. We use it to measure total solids of plasma when we do a PCV, or hematocrit tube. You break them in half and you use the plasma that's in there to read total solids. And then we also use it when we're doing a urinalysis. We use it to measure the specific gravity of the urinalysis. When you're using a refractometer, it should always be calibrated with distilled water. You do this by placing a drop of distilled water on there, and it should read at a specific gravity of 1. And if it does not, it actually comes with this little tool. It's almost like a little screwdriver, and you put it in there and you turn it until it reads 1 for the distilled water. And then when you're done with these, you always clean them with alcohol or lens paper before putting another sample on it. And another tool that you'll be using to complete your skills in this class or with any of these tests is the microscope. So the microscopes that we usually have 4 objectives. They have the 10x, the 40x, the 100x, and the oil. The 10x and the 40x we commonly use for urinalysis and fecals, and then we generally use the oil objective when we are looking at blood smears, for example, which means that you have to use oil. So some of the things to keep in mind with the microscope, you do want to alcohol the eye objectives before and after use, clean the microscope after use. You can clean the stage of the microscope, and also the objectives with lens paper. We want to clean this after every use, and always remember, as far as the oil, you do not want to get the oil on the other objectives. They're not meant to have oil on them. So you usually, when we're going back and forth, we turn the objectives so that the lower objectives pass first and don't go over the slide. So basically, you never want any of those objectives to pass through your oil on the slide. And another thing that you'll be using quite often is a centrifuge. They are used to separate different substances. Depending on the type of tube, you may be separating out plasma or serum. And we also use them for the urinalysis to spin down the sediment to the bottom of the urinalysis. And we also use them for certain type of fecal floats as well. So the most important thing to remember with the centrifuge is to remember that it is balanced. If it is not balanced, it may walk it off the table. So you always want to remember that you have 2 tubes, or wherever you have something exactly opposite it with approximately the same amount of substance or liquid in it. Also, you want to make sure that the top is closed before you start spinning it. And then usually there's a timer that, depending on the type of sample, keep in mind how long you need to spin it for, and also the speed of the centrifuge, which usually be found on the back of it somewhere. Depending on the type of sample, they do require different spinning times and speeds. One of the machines that you'll be using is the hematology analyzer. The hematology analyzer is the machine that runs your CBC, or complete blood count. So it counts the amount of red blood cells, it counts the white blood cells, and it counts the platelets. And then it also measures parameters of those cells. So the CBC tells us what cells we have in our body, if they're increased or decreased, depending on what it is. An increase of certain types of white blood cells may indicate inflammation or infection, and the parameters of the CBC can tell us if something is low or high. They usually classify and count cells based on size, shape, and density. Some of the downfalls due to these types of machines is they can misread or miscount cells. For example, if there's platelet clumping in a sample, it may give a very low value for platelets, and this is one of the reasons why you may have to make a blood smear in-house to do a manual platelet count. This is something that happens pretty often with cats since they're prone to platelet clumping, and this is one of the reasons why you do need to know how to make a blood smear. Okay, and then we also have the chemistry analyzers. And the chemistry analyzers are going to measure different values or assays that measure organ functions. So basically, some of the assays might be creatinine or BUN for the kidney, or ALT or alk-phos for the liver, or glucose or lipase for the pancreas. It also measures electrolytes like sodium, potassium, and chlorine, and blood glucose, I said, and also total proteins and globulins, and also albumin. So the chemistry machine runs all of this, and this is the chemistry machines usually require more quality control and maintenance than the hematology analyzers. So this is one of the machines that you may have to do a lot of quality control on. Here I just have a little animation of how we make a blood smear. For example, if you're going to do a CBC or a manual platelet count, and basically that is done by putting a drop of blood on one slide, and then we use another slide as like a spreader slide, and we usually keep it about 45 degrees. And there's two ways of doing this. You can either push into the blood and then pull back, or you can either come from behind the drop of blood and push forward. So most people pick one that works for them, as long as you can get that nice feathered edge, which we're going to talk about in a second, and that nice like bullet shape. Either way is fine. When you're making a blood smear, you should always make sure that the slides are clean and new, without any smudges or grease on them, and make sure that the blood is thoroughly mixed. So usually we have something that's called like a rocker that will put our EDTA tubes on. Whenever you do a differential or a CBC, it is always done on a purple top tube or an EDTA tube. And we usually either rock these by hand, or you can put them on a rocker which rocks the tube back and forth. So it should be mixed thoroughly before you make a smear or before you run the sample through any machine. So again, you can apply one drop of blood, and you see here they put it up top near the frosted edge because you want to leave as much room as possible on the slide to make your smear, and you also want to leave the frosted edge for any label that you want to put on here to identify whose blood smear this is. The blood, the drop of blood can be applied to the slide using a hematocrit tube or like two wooden dowels that you dip into the blood, which usually works pretty good, and then you just dab one little dot of blood onto the slide. Making a blood smear is a very important part of a CBC, as certain things can only be seen in the blood and not evaluated by a machine. Certain things like cell morphology and cell abnormalities. So it is important to be able to make a blood smear in any lab or hospital where we're running CBCs. Preparation, again, should always be done with clean slides. It is a skill that requires practice, but you can get it eventually with consistency. Again, you can try several different methods, but most commonly we use this method here. And you can see here, this is from the pull back method. So this is the opposite of what was in the animation. So you put the drop of blood down, you pull the spreader slide into the blood, and then you push forward. So, and looking at this smear here, technically this is not a very good smear. We don't want the edges of the blood going off the slide. We do want that like bullet shape where the entire shape is on the slide. And it isn't very important to make it right because we use a part of the slide to read the CBC specifically and do the platelet count. Which we'll talk about more in the next slide. And this is another reason why we use EDTA tubes to do CBCs and blood smears, is because EDTA specifically preserves cell morphology so that we can look at it under the microscope. Once you have made your blood smear, it should be allowed to dry pretty quickly by standing it up against something usually, or in a slide drying rack, and then we stain them. So you want to make sure that the slide is completely dry before staining it, and then we'll talk more about the staining procedure in a little while. All slides should be labeled with the patient's name and the date or ID number that is in their chart, and they should be stained within several hours. So any lapse longer than 48 hours may result in inadequate staining. And any unstained smears that may be sent out to a reference laboratory should be stored at room temperature, not in a refrigerator or freezer, because the water condensation will damage the cells. And also any unstained smears should be stored away from formalin fumes, and also shipped separately from any biopsy jars that have formalin in them, because formalin vapors can inhibit the optimal staining. So just some things to keep in mind with your smears and slides. Okay, so on a good smear, again, you can see that the entire shape is on the slide. It's not running off of the slide. And there are three parts to a blood smear. So you have the feathered edge, the monolayer, and the body. And the monolayer is where we do all of our reading of the cells. The monolayer is where the cells are accurately spaced apart from each other, and this is where you would do a platelet count or a CBC differential or any evaluation of the cells. On the feathered edge, the cells are going to be very spaced out, and also a lot of the white blood cells will be dragged down there because they're a little heavier. So the feathered edge is going to look a little bit different. The cells are going to be far apart from each other, and that's not an accurate representation of the blood. And then back in the body, the cells appear agglutinated, and they're all kind of squished together closer to the drop part of the smear. And this is another reason why you don't want your bullet shape there to go off the slide, because then you lose some of your monolayer, which we use to evaluate the blood. After you make a blood smear, you need to stain it. There are a couple different types of stains. The Romanowski type stains use a blue or red element, and they are used to look at cell morphology or bone marrow. And depending on the type, they may be used for specific things like lymphoma. We generally use Diff-Quick stain, which is a type of Romanowski stain, which has both the red or eosinophilic or the blue or basophilic dye to dye both red blood cells and white blood cells and platelets. This is what we use for a CBC differential or a blood smear. There are also other stains out there. Some of them are called Papa Nicolau stains, and one of them is new methylene blue. New methylene blue is especially used to stain chromatin or material that's inside the cytoplasm. So we use new methylene blue when we're doing the reticulocyte count because it dyes the RNA in the reticulocytes. Below, you see an example of the Diff-Quick stain. It is made up of three elements. The first one is a fixative reagent that sets the cells, and it's kind of a clear blue. And then the second one is the eosinophilic dye, which picks up the reds, like the red blood cells and the granules in the eosinophils. And then you have the blue basophilic dye, which picks up the white blood cells and the granules within the white blood cells and the platelets and other things as well inside the cells. So usually what we do is we put it in jars like this, and you'll have an extra jar for water that you use to rinse the cell at the end. And below you can see a blood smear, and you can see that the red blood cells are picking up the red dye or stain, and the purplish or blue white blood cell nuclei are being picked up as well. So you can see there's two neutrophils here where we are staining purple, their nuclei, and then the nucleus of the lymphocyte in the right hand corner is also picking up the blue dye. Below is an example of the new methylene blue stain being used for a reticulocyte count. Reticulocytes are immature red blood cells that still have some of the RNA from the nuclei left over. And with the new methylene blue stain, that is what stains you can see in the little reticulocytes that the arrows are pointing to. Now with the Romanowski type stain that we use for a blood smear, these reticulocytes will appear as polychromatophils, or cells that have polychromasia, and the inside RNA is not as visible. So here you can see an example of what the eosinophilic dye stains and what the methylene blue or basophilic dye stains. So up here you have the red blood cells take up the red stain, and then you have the granules inside of the eosinophil that stain red. And then down below here, you can see there's a platelet right here that takes up the blue dye. This is a basophil, and you can see inside that the nucleus is taking up the dye, and then also the granules that are all around it are taking up the dye. So the white blood cells, all of them take up the basophilic dye for the nucleus part, and then if there's any granules, like neutrophils as well have granules, but they're not always as visible unless it's a toxic neutrophil. And then also red blood cells may have inclusions like Howell Jolly bodies. There's none here, but we'll get to that, which also take up the stain. Okay, so when you're staining with DiffQuick, there's a procedure that we follow. Remember, when you make blood smears, you should always try to make two if you have enough blood, just in case one of them gets ruined during the staining process. And always make sure that the slide is dry before you attempt to stain it, because otherwise the cells may rinse off during the staining or rinsing. So during the DiffQuick stain, you basically either let it sit or dunk it in the fixative. You can let it sit for 60 seconds, or you can dunk it about 10 times. And then you blot off somewhere on a paper towel nearby, or put this on a wee pad, or it depends how the clinic does it. But it's basically you dunk it in here and then you dry it off, and then you do the same thing for the next two. Personally, I find that 10 dunks in the fixative, blot off, 10 dunks in the red, blot off, and 8 in the purple, blot off works best for me. I just find that the blue stain is a little heavier, and you just need a little bit less. But that's just me. And then once you blot off, you're going to rinse the blood smear, and you're going to make sure that you don't rinse directly over the actual smear. So just under the feathered edge and the back of the slide, you're going to rinse with water, and then you're going to prop it up somewhere, either against the wall or backsplash, or in a slide drying rack, and let it completely dry before you look at it under the microscope. Just a quick review here of the cardiovascular system. The blood lives within the cardiovascular system and is transported throughout the body via the circulatory or cardiovascular system, which delivers oxygen and nutrients to cells through the blood and removes waste. The system is comprised of the heart, the blood itself, and the blood vessels. The blood is comprised of plasma, red blood cells, white blood cells, and platelets. The circulation has two main loops. There's pulmonary circulation, which removes carbon dioxide and replaces it with oxygen in the lungs. And then there is systemic circulation, which supplies oxygenated blood and nutrients to the body. The blood or cardiovascular system works together with your lymphatic system. The lymphatic system is a network of organs, vessels, and tissues that work together to move a colorless watery fluid or lymph back into your circulatory system or bloodstream. So basically the lymph system removes excess fluid in the tissue. If it is not removed, that could result in edema, and the lymph nodes filter out that lymph fluid. The lymph system also assists with protein transport. So the two systems work together to basically balance and control the fluid in your body. Blood usually comprises 8 to 10% of our body weight, and it is made up of 4 main components. It has 3 different types of cells. That's the red blood cells or erythrocytes, the white blood cells or leukocytes, and the platelets or thrombocytes. And there's also a liquid component called plasma. And if you can see over here on the right, there is an example of whole blood that has either been spun down or is left to sit. And you can see that the way that it would separate is the red blood cells on the bottom, the white blood cells and platelets together in a thin band, and then the rest is the liquid portion or plasma. Serum comes from plasma that has clotted. So once blood has clotted in a tube, for example, fibrinogen, which is a clotting factor, is removed during the clotting process, and the fluid that is left over is called serum. So plasma is the natural component of whole blood, and serum is derived from blood once it has clotted. Blood usually has a pH of 7.4 or just above 7 for humans and small animals. Plasma, the fluid portion of the blood, is about 90% water, but it also has some other components such as nutrients, ions like some of your electrolytes like sodium and chloride, gases like oxygen and carbon dioxide, and waste products like urea and bilirubin, and then also proteins. So the proteins that are dissolved in the blood are albumin, which makes up most of the proteins in plasma or serum, and it is the major binding and transport protein in the blood. It is responsible for maintaining osmotic pressure of the plasma. Globulins are a complex group of proteins synthesized by the liver, and they primarily transport and bind proteins. And then fibrinogen is synthesized by hepatocytes, and it is the precursor of fibrin, which is the mesh that forms over the platelet plug that forms when a blood clot forms. So basically, it is, again, one of the clotting factors. So as we discussed, serum is the fluid portion of the blood after it is clotted and after fibrinogen has been removed in the clot. As you can see here, this is a serum separator, gold tube, and there is gel in the middle. Before you put the blood in this tube, the gel will be on the bottom. And because of the density of the gel is designed to be somewhere in between the density of the blood cells and the density of the serum, once you centrifuge the sample, the gel will be in the middle and the cells will be on the bottom and the serum will be on top. And once again, this is serum because the blood has clotted in this tube. This is just a different representation of the same principle. On the left here, you can see this is whole blood. It's not clotted. This is whole blood that's been allowed to settle. So what's in the middle here is the buffy coat, which is comprised of the white blood cells and the platelets, and the plasma is on top, and the red blood cells are on the bottom. In a clotted sample, notice there's no gel in this tube, so there's nothing to separate this, and this is not how it would look either. So this is just metaphorically representing the clot, and the clot contains all of the blood cells and the fibrinogen that's been converted to fibrin, and anything that is left outside of that is serum. And again, serum is the liquid minus the clotting elements or fibrinogen. Hematopoiesis is the production of blood cells. So basically, it encompasses the production of all of the blood cells. Heme, again, means blood, and poiesis means production of. So the blood cells are constantly being reproduced because they do have a lifespan and they're constantly being replaced. And to the left, you can see an in general rule of thumb for the lifespan of the different types of blood cells. Hematopoiesis, or the production of blood, occurs mainly in the long bones, in the bone marrow, in the femur and tibia, and also in the liver and spleen and lymph nodes. All of the cells in the blood differentiate from one pluripotent hematopoietic stem cell. And this is this up top. There are two lines. There can be the lymphoid lineage and then the myeloid lineage. the lymphoid lineage produces the lymphocytes, and then the myeloid lineage produces the rest of the blood cells, including the platelets, the red blood cells, and the white blood cells. When white blood cells are produced, we call this leukopoiesis. When red blood cells are produced, we call this erythropoiesis. And when platelets are produced, we call this thrombopoiesis. So thrombocytes or platelets are formed from megakaryocytes. Erythrocytes differentiate, or red blood cells, from the myeloid lineage, and then myeloblasts form the rest of the white blood cells besides lymphocytes. So basophils, neutrophils, eosinophils, and monocytes all differentiate from myeloblasts. So here is an example of a blood smear, and I want you guys to start being able to identify the different types of cells. So if you look, these are all red blood cells or erythrocytes. They're taking up the red stain, and they do not have a nucleus inside, and they usually have some amount of central pallor depending on the species. Now, white blood cells are these guys here. They are much bigger than the red blood cells. They have a nucleus that usually takes up the blue stain. And here we have two neutrophils, which usually have multi-segmented nuclei, a lymphocyte, which the nucleus usually takes up the entire cell, and then a monocyte, which is usually the biggest of the white blood cells and also has more of like a kidney-shaped nucleus. And then over here we have some platelets or thrombocytes, which these look like they're kind of clumped together. This is a single platelet up here, this little tiny purple dot, and then these is like a little clump of platelets that are together. So just start trying to be able to identify the difference between the platelets, the red blood cells, and the white blood cells. Okay, here's a nice little breakdown of the cells that would be in a centrifuged blood sample. You have the platelets or thrombocytes, we have the leukocytes or white blood cells, and then we have the erythrocytes or red blood cells. In a blood tube, it's estimated that there would be 5 to 6 million erythrocytes present. There's usually, in adults, we have 20 to 30 trillion red blood cells. So this is just in this tube. And red blood cells primarily transport oxygen and carbon dioxide. Leukocytes, you would have about 5 to 10,000 white blood cells in this tube. There are 5 different types of leukocytes. Those are the basophils, eosinophils, and neutrophils, and then you have the lymphocytes and the monocytes. Now, white blood cells are primarily used in the immune system for immune function and defense, and we will talk more about that in a minute. And then platelets, there would probably be about 250,000 to 400,000 platelets in this tube. And thrombocytes or platelets, their main function is the clotting of blood. Red blood cells or erythrocytes are a biconcave disc shape, which allows for the easy diffusion of oxygen and CO2 or carbon dioxide. And they are also composed of proteins that let the cells stretch and bend and fold so they can fit through smaller vessels and capillaries and spring back to shape. These red blood cells, again, are produced in the long bones, bone marrow. The red blood cells are unable to repair themselves. They do not have a nucleus. Mature red blood cells do not have a nucleus. And they usually have a lifespan of 100 to 120 days. And at the end of their lifespan, they pass through the spleen and liver, and they are consumed by macrophages. The red blood cell is the most numerous of the formed elements or cells in the body. And just a little bit more about the red blood cell. So again, they have a really thin membrane that allows for diffusion of the gases, as that is their main function, to take oxygen from the lungs to the rest of the body and the tissues, and to pick up the carbon dioxide from the tissues and bring it back to unload to the lungs to exhale. Again, they don't have a nucleus when they're mature. Immature red blood cells do have a nucleus, but they lose it before maturity. And as they get older, their the membrane, that thin membrane, starts to deteriorate, and that is when they are eaten up by phagocytosis, by the macrophages in the liver and spleen. So again, that shape that they have is almost two-dimensional in a way, and that shape allows for more surface area for uptake of gases. The lifespan of the red blood cells is about 120 days, and red blood cells also have no organelles. They're basically just the membrane and the bilipid layer. So they also carry hemoglobin, which is a protein, and hemoglobin is the protein that is responsible for actually attaching and carrying the oxygen within the cell. Okay, take a closer look at the hemoglobin molecule in the upper right hand corner there. The hemoglobin molecule contains something called a heme group. Oxygen binds to hemoglobin in what is called a covalent bond between the oxygen and an iron atom that is in the heme group of the hemoglobin subunit. The heme group is a group within the hemoglobin protein that contains the iron atom in its center. Each hemoglobin molecule has 4 binding sites for oxygen molecules, and each subunit can bind 4 oxygen molecules. And this is important. This is exactly why iron is important, because it is needed to bind to the oxygen. And as you can see here, the oxygen diffuses into the cell, it binds with the hemoglobin molecules, and it is again released into the tissues through the membrane. And again, this is what red blood cells will look like, taking up the red stain on a blood smear. Some of these are overlapping up top here, but they all seem pretty normal. There is, I would say, some poikilocytosis down here, which is basically different shape. You can see this one has some burred edges, but for the most part, all these cells are around the same size and look normal. Erythropoiesis, again, is the production of red blood cells. Eryth means red, and poiesis means production of. And it occurs in the bone marrow, and it is controlled by hormones, mainly erythropoietin. Erythropoietin is epigen, basically. So when an animal or a human is anemic, they are given epigen injections, and what it is the hormone erythropoietin, which stimulates red blood cell production. It is released from cells in the kidney, and it is released in response to hypoxia. So if there is low oxygen in the body, epigen would be released to stimulate red blood cell production. And this is one of the reasons why you might see a bunch of immature red blood cells, because the body is rushing to pump them out to make up for the low oxygen. Okay, so here is the basic flow of red blood cell formation. They start off as stem cells, and they become what's known as a committed cell to take the line to form an erythrocyte. And then the earliest stage is the early erythroblast, the late erythroblast. And as you can see, these early stages have nucleus or nuclei. And then the next stage is something called a normoblast, or what is otherwise known as a nucleated red blood cell. These, it is normal to see 2 to 3 in a blood sample, as they are just part of normal erythrocyte production. However, if you see a large amount of these, it may signal that, again, like we discussed in the slide before, that there was an influx of red blood cells or need for red blood cells, and immature cells were released. And also, another interesting thing about the nucleated red blood cells, the laser analyzers or the hematology analyzers may count these nucleated red blood cells as white blood cells because they have nuclei. And if you see a significant amount, there is a mathematical equation which basically makes up for the amount of cells in the differential that may have been counted as white blood cells when really they were immature red blood cells. Next is the reticulocyte in the phase, and the reticulocyte no longer has the nucleus, as you can see, but it does have some of the RNA left over in it. And reticulocytes, again, are normal to see a few. Same thing, if there are more in the blood, this may signify a problem. And then lastly, we have our mature erythrocyte. Okay, we're going to talk a little bit more about reticulocytes. So on the right here, you have this diagram which shows what some red blood cells and reticulocytes would look like in different stains. So on the left here, we have the right Giemsa stain, and on the right, we have the new methylene blue stain, which is used specifically to see reticulocytes because, as you can see, it stains the RNA within the cells better than the Diffquik type stain. So here you can see this is a nucleated red blood cell up top, and then these are reticulocytes where in the Diffquik stain you can't see the chromatin that is in them. Now on the new methylene blue stain you can see the reticulocytes, and there are two types of reticulocytes. There's the aggregate reticulocytes and the punctuate reticulocytes. And the aggregate ones, you can see that the RNA is kind of clumped together or aggregated together. And in the punctate ones, you can see that there's just little dots or scattered single kind of chromatin RNA spots on the cells. So cats, we know, have both aggregate and punctate reticulocytes in their blood, but dogs only have the aggregate type. And here we have a picture of some stained reticulocytes, and you can see the big arrow here is pointing to what we would call an aggregate reticulocyte, and then these smaller arrows and basically all the cells that are surrounding this one are the punctate type. Okay, so as we discussed, mammalian red blood cells are usually that biconcave disc shape, but there are some species where they are more oval shaped and they also have nuclei. Birds and reptiles, for example, their red blood cells and platelets both have a centrally located nucleus and are oval shaped. The nucleus usually stains basophilic with eosinophilic cytoplasm. So they kind of look, you see that purple or blue in the nucleus, and then you see the red stain or dye in the cytoplasm out around the nucleus. Also, camelids or alpacas and llamas in that family, they also have oval-shaped red blood cells. Okay, here's an example from llama blood, and these are llama erythrocytes. And as you can see, they are oval shaped instead of biconcave disc. However, they are mammals, so they do not have nucleated red blood cells. Okay, we're going to talk about white blood cells or leukocytes. The stem leuc means white and cyte means cell. So leukocyte means white cells or white blood cells. There are 5 different kinds, which we're going to talk about in detail. They are the monocyte, eosinophil, basophil, neutrophil, and lymphocyte. All the white blood cells have nucleus or have nuclei. They are also mostly produced in the bone marrow. Their lifespan varies from 12 hours to several years, depending on the type of white blood cell. Their main function is to protect the body from infectious microorganisms. They function in the blood, but also in the tissue. And the act of the white blood cells leaving the bloodstream to go into the tissues is known as diapedesis. So start trying to remember this phrase to remember your white blood cells. Never let monkeys eat bananas. So if you can remember that phrase, you can remember neutrophils, lymphocytes, monocytes, eosinophils, and basophils. And as you can see, those are the 5 types of white blood cells. If you can also remember it in this order, you're remembering the order of which they appear most numerous in the blood in most species. So, for example, in humans, cats, and dogs, we have mostly neutrophils circulating, then lymphocytes, then monos, then eosinophils, and basophils are the least numerous in the blood. The white blood cells are broken down into two categories. We have the granulocytes and the agranulocytes. The basophil, neutrophil, and eosinophil contain granules, which makes them granulocytes. The lymphocyte and monocyte do not have granules, so they are agranulocytes. An easy way to remember this is that the phils, basophil, neutrophil, and eosinophil, are filled with granules, and the cytes, lymphocyte and monocyte, are quite empty. So the phils are filled with granules, and the cytes are quite empty. In this picture, we show what the white blood cells look like under the microscope and how they take up the different dyes. So again, the eosinophilic dye takes up anything red, like the red blood cells, and then the basophilic dye takes up anything blue or purple that catches the blue or purple stain. So here, all the way to the left, we have the neutrophil, which again has many lobes in its nucleus, and the DNA and RNA material is staining blue and purple, and you can see there are some granules. Neutrophils tend to have a pinkish, pale cytoplasm. Eosinophils, they have the bilobe nucleus that's staining basophilic, but they have those red granules inside that take up the eosinophilic dyes. The basophil has the basophilic nucleus, and it also has the basophilic granules that tend to look dark blue. And again, you probably will not see many basophils in your lifetime. They're very rare, unless there's some kind of allergic reaction occurring. Lymphocytes over here, the whole nucleus again is staining purple, taking up the whole cell, and they do have slightly blue or basophilic cytoplasm around that large nucleus. And then the monocyte on the end, you can see takes up the basophilic dye. It usually has that kidney-shaped nucleus. They are bigger than the rest of the white blood cells, and it usually has blue, almost foamy-like appearance in its cytoplasm, where there are vacuoles kind of making holes in the cytoplasm, which makes it have this foamy appearance. Okay, we're going to talk about neutrophils. So again, neutrophil is the most numerous white blood cell in most species, except we know in cows that lymphocytes are the most numerous in cows. The primary function of the neutrophil is phagocytosis. They work in the immune system. They are definitely increased when there is infection or inflammation, and in this case you may see a lot of immature neutrophils, which are also known as band cells. Their nucleus is multi-segmented, anywhere from 2 to 6 lobes, and they start off as kind of a horseshoe shape, which is a band cell, and as they age, they segment more and more. So the more segments you see in a white blood cell, the older that cell is. They are granulocytes. They have granules. The granules usually do not stain. They are barely visible. The average lifespan of a neutrophil is 4 to 6 hours, and they are also known as PMNs, or polymorphonuclear leukocytes. The reason being is that their nucleus has many segments. Eosinophils, again, are granulocytes. They have red granules. Depending on the species, they make up a small portion of the blood, about 1 to 4% of all the white blood cells. The red granules are very large and very visible, and the eosinophils' main function is they are involved in allergic reactions, parasitic infections, and asthma. Their lifespan is generally only about a few days. Okay, let's talk about basophils. Again, these are the most rare form of white blood cell, making up about 0.5% of all the white blood cells in most species, and then they may be more commonly seen in horses than other species, but still rare and only a few of them. The nucleus, again, is usually bilobed, and they do have darker staining basophilic granules that are visible. These granules contain histamine and also heparin, as basophils are involved in inflammatory responses, especially to allergic reactions and ectoparasites. Ectoparasite meaning a parasite outside of the body, so something like fleas, for example, or ticks. And the average lifespan of basophils is anywhere from 1 to 2 days. Lymphocytes are agranulocytes. As you can see, the nucleus takes up about 90% of the cell, and it does stain dark blue with the basophilic dye. Lymphocytes are normally about 20 to 45% of the white blood cell count, except in cows when they're about around 50%. These lymphocytes are slightly larger than the erythrocytes or red blood cells, and our lymphocytes are the cells that attack specific antigens in our bodies as antibodies. They are also known as the third line of defense in the immune system, the first being the skin, the second being non-specific immunity, and the third being what we call humoral immunity, where our lymphocytes become natural killer cells and T cells and B plasma cells to attack specific pathogens or antigens as antibodies in our blood. And lastly, from the white blood cells, we have monocytes. Monocytes are the largest of the white blood cells. They take up anywhere from 4 to 8%. Again, this is going to be different from species, sometimes more like 10 to 15. They have the big nucleus that is usually kidney shaped but can vary in shape. And it does stain the basophilic dye, but usually not as dark as the lymphocytes, for example. Monocytes enter the tissue via diapedesis and they become macrophages, where they perform phagocytosis. They almost like garbage trucks. They eat up everything and clean up debris from old cells, like dying red blood cells, for example. They do tend to have a foamy appearance to their cytoplasm. It is normal to find vacuoles in the cytoplasm, which gives it this almost lacy or foamy appearance. An increase in the foamy appearance may signify that there is increased metabolic activity and increased phagocytosis going on. The last type of cell in the blood are the platelets or thrombocytes. Cyte again means cell, and thrombo, the origin of the word, means thick or clot, so clot cells. And platelets actually are not cells, they are cell fragments, and they are very small. They're about 2 to 4 micrometers in diameter, whereas the red blood cell is about 7.5. If you take a look here, these are the platelets, the little purple dots on the slide. These are the platelets, and look how small they are in comparison to the red blood cells. And if you remember from our slide before, the platelets originate from megakaryocytes in the bone marrow. They do live in the spaces in between the erythrocytes. These are singular platelets, so they're not clumping or clotting. And platelets in general are involved in the clotting cycle or the clotting process. The average lifespan of the platelets are anywhere from 4 to 10 days. Again, this is going to depend on the species, and they are small fragments of bone marrow cells. Their main function is to create the platelet plug, which forms the clot to stop bleeding. They do secrete chemicals to attract other white blood cells to sites of inflammation, and they also secrete growth factor, which helps to maintain blood vessel linings. Okay, we talked a bunch about blood. We're going to talk a little bit about the blood tubes that you'll see in vet med. These are the two most common tubes that you'll be using to run things like chemistries and CBCs. So on the left, you have the serum separator, which has different looks. It can have the tiger top, which is kind of a red marbled gray. They can be red and black. They can be orange. Any tube that you purchase, depending on who makes it, the manufacturer, it will say on the side of the tube whether or not it's a serum separator. It'll say SST. So, and the serum separators will have gel in them. So the one below that is shown here has gel in the middle and clot activator in it. So the clot activator in the tube will stimulate the blood to clot. And again, remember, when blood clots, it makes serum. So the fibrinogen is removed from the plasma, and outside of the clot, we have the leftover fluid is serum. These tubes we use in vet med for chemistries and antibody testings and lots of other things. When you pull blood into these tubes, you're going to collect the sample and add it to the tube either through the vacutainer or by taking the top off. And you're going to let the blood clot first before you spin it down. Depending on the species, again, like for example, horses' blood takes a long time to clot. But generally, most blood clots within about 10 minutes, and then you're going to spin it down. So after a centrifuge, you usually centrifuge for about 10 minutes. And once the blood is separated, you will see that the gel will be in between the cells and the serum. Uh, the gel is designed to have a density that is slightly less than the serum, but more than the cells. And once these tubes are spun down and separated, you cannot remix them or reconstitute the blood into whole blood again. Another important thing to note about serum separators is that if you leave the blood clotted and do not centrifuge it down for some time, the glucose will start to deteriorate in the tube. So the glucose level will go down as much as 10% per hour that a serum separator tube is not centrifuged and separated. To the right, we have the EDTA tubes. Don't ask me to say what EDTA stands for. It's right there. It's a very long word. EDTA is a a chemical that is added to the blood to keep it from clotting. So it's an anticoagulant. So blood in purple top tubes is whole blood. And EDTA is also used to preserve cell morphology. So it is what we use when we're reading a CBC. So when you make a blood smear or you run a CBC, you're using an EDTA purple top tube. It is otherwise known as the hematology tube. Purple top tubes must be filled to the line that is indicated on the tube so that the additive and the blood ratio is correct. And also, after filling a purple top tube, you should gently invert it so that the anticoagulant mixes with the blood and it doesn't clot. We have these rockers that you can put the tubes on that rock it for you until you're ready to run the sample. Two other more common tubes you may see are the green top tube and the plain red top tube. The green top tubes are commonly used for chemistries, for exotics, and other specialty tests. There is heparin in these tubes, and as you may know, heparin is an anticoagulant, so it keeps the blood from clotting. So when you keep the blood from clotting, you have whole blood. So that means when you separate out these green top tubes, you get plasma, not serum. Now, these green top tubes may be made with gel or not. So if they have gel, it will separate out the plasma for you when you spin it down. The ones without gel, the only difference is that if you tip it, it's going to remix again, but it's still going to give you plasma when spun down if it's a green top tube. The lithium heparin blood is not used for blood smears or CBCs, as the lithium heparin may interfere with the staining or cause clumping. And this is another tube where you want to make sure that you put in the correct amount of blood so that the anticoagulant mixes with the blood in the proper ratio. The plain red top tube is another tube that we use for certain chemistries. For example, it's used for digoxin levels commonly. They can either have no additives in the tube, or some of them may have clot activators. And again, it's gonna say it on the side of the tube on the label here. It's gonna say whether it's a no additive or a clot activator. But when you put blood in these tubes, they are going to clot. So this tube is going to yield serum. So again, they may have no additives or they may have a clot activating coat on the inside. These are also sterile tubes. The non-additive tubes can be used for urine, blood, bodily fluid. Again, this is something where you'd want to label what you're putting in there in the non-additive tube. And they can be centrifuged down, and again, this is a tube. If it doesn't have gel, if you mix it or if you invert it, the blood in there is going to mix again. But when you spin it down, you will have serum on top because the blood does clot in these. The blue top tubes are what we call our coagulation tubes. Most tests that we do to see if a patient is having coagulation issues are done off of the blue top tube. Most common are the PT and the PTT, for example, prior to surgery. The blue top tube has sodium citrate in it. Now, with the blue top tube, it is extremely important that the ratio be correct, and there is a line indicated on these tubes. And with this tube, it's more important than others. The blue top tube, again, is used for coagulation studies, and it always needs to be filled to the line. So whenever you're pulling tubes, you may want to make sure you have enough blood in this tube first. The gray top tube is a lot less common than some of these other ones, but they have potassium oxalate or sodium fluoride additives. They're used for certain coag testing as well and glucose studies. The gray top tube prevents glucose from being utilized by cells for energy to preserve real-time value. And this is another tube where we want to have the proper ratio to the additive of blood. So this brings me to the order of the draw, which is an important thing to know if you're pulling multiple samples from a patient. There is a proper order in which we pull the tubes so that the results do not get skewed. And, as we discussed before, there are many things that can affect the accuracy or the results of a sample. And one of them is the order of the draw. So there is a correct way to do this. So the mnemonic that we use to remember the order of the draw is stop, light, red, stay, green, power, light, go. Stop, or S, stands for sterile. Light stands for light blue. Red is your red top tube. Stay is for your serum separator. Green is for your green top tube. Power is for your purple top tube. Light is for your light pink tube, which we won't see much in veterinary medicine. And go is for your gray top tube. So if you're pulling blood for a blood culture, we really want to make sure that we have a sterile sample if we're testing for some kind of bacteria in the blood. So if you're doing blood cultures, they should ultimately be the first thing that you pull from the patient. Blood culture bottles have an additive of a nutrient broth and an anticoagulant that keeps the blood from clotting. There are 3 different types of blood culture bottles. They come in anaerobic, aerobic, and fungal, and they do require lots of blood to fill them. The blue top tube should be immediately after the blood cultures or first if you're not doing blood cultures. The reason being, there's a few reasons. They're used in coag studies, so you want to get the blood before it clots. Also, the additive in the blue top tubes, the sodium citrate, binds to calcium. So, for example, if you get the sodium citrate blood into your serum separator by accident, what could happen is you would have a low calcium value because the sodium citrate is binding calcium. Another thing that might happen is EDTA is high in potassium, so that might affect your chemistry as well. So for those reasons, we want the blue top to be next in the order of the draw. The next tube to pull if you're pulling multiple tubes would be the red top tube. Again, these can be no additive or they can have the silica coating, which is the clot activator. And again, these are used for chemistries. And right after the clot activating tubes, you would have the serum separator, which has no additive. And again, because they're used for chemistries, you want to make sure that we don't get that sodium citrate from the blue top tube in there. After the serum separators comes the green top tube or the lithium heparin tubes. And again, these can be with gel or without. And something that the green top tubes, again, they have anticoagulants, so you wouldn't want that getting in your serum separator. And the purple top tube comes after the green top tube. Not only does the purple top tube have an anticoagulant that you wouldn't want to get in your serum separator, but these tubes are also high in potassium and they bind other ions like calcium. Okay, so remember your order of the draw, and remember that there are also other things that can influence sample results, being hemolysis, icterus, and lipemia. Like we discussed, certain medications can influence blood work, as well as sample handling or improper labeling. So remember to keep these things in mind as a technician when you are obtaining samples and running your tests.